What do they call the federal government here? Is it the federal government in
Fellow
Canada?
government?
The federal.
Oh, federal
Is
government?
is it called federal in
Yeah,
Canada?
yeah.
Yeah, yeah. So like the federal government was pressuring provinces
Mm-hmm.
to say we are seeing an increased number of private healthcare practitioners, and you need to correct this, or there will be consequences. And it goes the exact opposite of what you're saying, bro.
Don't do this.
Don't do
We
this.
don't
No.
need the good service.
No, and it's terrible because like it is terrible, bro. Like I'll give you a true story. I was pretty upset, like because it also shows there's just like a lack of general caring. Is I told you that I tore a ligament in my leg, right? Well, I didn't know what was going on, so they first gave me an ultrasound.
Mm-hmm.
And before they gave me the ultrasound, I back up a step, is they gave me a test to check if I had a blood clot. Okay. And so, one, rather than, so they gave me a test to test the blood clot. The blood clot test cannot rule out a blood clot. It just gives you a probability. So like, it's something like, I forget what the numbers are, but if it's like 500 or higher, then you have a high probability of a blood clot, but it doesn't mean you have a blood clot.
Okay.
If you have lower, then that doesn't count, right? So first thing is they do this test rather than just give you an ultrasound, and an ultrasound can tell you if you have a blood clot. Okay, so like, and an ultrasound just tells you yes or no, you have a blood clot, because they can go in and look.
What did they do? Why did they do the blood clot thing?
Oh,
did they have to do that test?
So
the second one you're saying tells the whole story.
So the second one tells the whole story, but because I'm low risk, they said, oh, the first test is enough. So basically, what they're saying is, you're in a low enough risk category that we can give you this first test, and we're pretty much feel pretty comfortable that you're okay. But if you look at the test, like, I understand the first test is cheaper and it's faster, but an MRI is not, or a ultrasound is not a very complicated thing to do, and it's not horribly expensive when you have a healthcare system like Canada. So I did the first test. I score 490 out of 500. And the doctor's like, well, this is a little high, a little more not comfortable with, so let's go ahead and do the ultrasound. So then I'm in there and I'm doing the ultrasound, and they're going all over my leg. And then the technician's going, oh no. And then she's says, I found something. And then so turns out, after talking with her, because she found a 10 centimeter tear in my leg, right?
Oh shoot.
And then they found a very, very, very tiny superficial blood clot. So the dangerous ones are called a DVT, and those are on the inside, right? But on the outside, probably the blood clot was caused because my ligament tore, right? And it probably just like messed things up. Well, they didn't explain any of this to me. They just said, oh, you have a problem, but it's 9:30 and we're closing soon, and the doctor on duty doesn't have time to look at you, so we recommend that you go to the emergency room. And the doctor is in there, and like the nurse practitioner and the lady who did the scan, right, are both talking to the doctor. I can hear them, and the doctor's like, no, I don't have time. And like, he can go to the emergency room. Like,
damn it.
Yeah. And so like, at this point, I'm paranoid, right? Because I don't know what's going on. Like, they tell me I have a minor blood clot. They're not willing to do anything. So then the story gets worse. So then I go to the emergency room, right? And I wait, dude, like 2-3 hours. So my night's wrecked. Like it's like midnight. I'm in the emergency room, and you know who I'm with? I'm with all the people from East Hastings. 90% of the people in there are like addicted to drugs, and so I'm waiting with these people, and then the doctor's so busy. He comes out and he's like, "Well, we don't have your scan because it takes time for the system at the to give us your results." He's like, "So we don't know. I don't know exactly what the problem is. So what you need to do is you need to take this prescription for blood thinners, and you're going to take blood thinners, in case it's a blood clot, and goodbye." Like that's literally what he said is, "Here's a prescription and buy." They didn't really talk to me anything more, because they didn't have any results. They could have done another scan there because they have equipment in the emergency room to do it. They opted not to. So then I start taking you read all the side effects from blood thinners. That's terrible, bro. It's terrible. So I go pay $200 to get the blood thinner. I take one pill in the morning because it took that long to like get the prescription for various reasons. And so I take one pill of the blood thinner, and I'm feeling terrible at this point, right? I'm like, I got a blood clot. I'm getting old. My life, like I need to start changing some stuff. Like all this thoughts, like my life is deteriorating, spiraling down, right? Then my family doctor, the nurse practitioner, calls me, and he's like, "Oh, so we got your results." So he calls me at 4 p.m. the next day, right? So he waits the whole day, right? So I'm thinking all this because he's like, "Okay, we got your results, and you do have a blood clot, but it's very superficial. It's not a big deal. So you can go ahead and stop taking the blood thinners. You don't need to do anything, and we'll order you an MRI."
And the $200 is gone.
The 200,
all the stress,
and then I'm still waiting on the MRI. I'm still waiting on the MRI. And
you don't still have your final result of what the hell is going on with me.
No, dude. I was so angry because I was like, I took this freaking like blood thinner killer pill. You know what I mean? And I already have like low blood pressure and stuff, so like it's not good for me to take that stuff. And anyway, it ended up being this very small thing, but like that journey.
Unbelievable. Are you planning to head back to US any second?